Good afternoon. We'll start now. It's already 2 o'clock. So first of all, I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. As a reminder, please take the online learning evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate as shown below. The link is already in the chat box and is also posted in the Viber group and as well as the Facebook group. Another reminder, 50 OLETE certificates entitled 1 to a voucher for ROJoson telemedical consultation. This is our 50th pep talk. So after this, anyone who would complete the 50 OLETE certificates will be entitled to 1 voucher. Welcome everybody. So let's have a group picture now before we start the pep talk in 2 minutes. One, two, three. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer, depending on the enthusiasm of the participants. My pep talk today is entitled Fundamentals and Generalities in the Medical Management of Abdominal Hernias. Abdominal hernias. This is part of the health disorder course. The empowerment objective is for the lay people to have a better understanding of the fundamentals and generalities in the medical management of abdominal hernias. The contents of this pep talk on abdominal hernias will be the following. What are abdominal hernias? Different types, different causes. Are there preventive measures against abdominal hernias? How common? Clinical diagnosis, paraclinical diagnostic procedures, basic treatment modalities for abdominal hernias, and then I will have an overview on the groin and inguinal hernias, as these are the most common abdominal hernias. Then I will present some myth and fact on inguinal hernias. Definition of terms in the title and the limitation of the coverage of my talk. The word fundamentals will be used to mean the simplest and essential facts and theories which can serve as a basis or foundation and support for advanced and future information. Generalities will be used to mean general statements of information, not covering specifics and details. And medical management to mean diagnosis and treatment usually being done by physicians. So let's start with the first topic. What are abdominal hernias? Abdominal hernias consist of a defect or a hole or weakness in the abdominal wall or a peritoneal or mesenteric aperture or opening inside the abdominal cavity that allows the abdominal tissues or organs like the small intestine to bulge through and be trapped inside the aperture. What are the different types of abdominal hernias? As defined earlier, there are two general ways of classifying the types. One is based on location. One is external and internal abdominal hernias. The other type will be another classification will be hernias just based on the specific location. And then there are two general ways of classifying the types of abdominal hernias based on cause. The first one that I presented is based on location. Now this is the classification based on the cause. Okay, so congenital versus acquired hernias, incisional and non-incisional hernias. I will explain this later on. So the first category of type will be external and internal hernias. So here you have external hernias, okay, and then this one is internal hernias. So external abdominal hernias are those in which the abdominal organs or tissues leave their normal anatomic site and protrude through towards the skin of the abdomen because of a congenital or acquired defect or hole or weakness in the abdominal wall. So this picture shows external abdominal hernias. Okay. There are so many types of external abdominal hernias, but this one illustrates that there's a defect here, and then there's a organ, which is usually the small intestine that protrudes through the opening, and then it can be easily seen or can be seen through the abdominal wall or through the skin. Okay. Internal abdominal hernias are those in which the abdominal organs or tissues protrude through a peritoneal or mesenteric opening inside the abdominal cavity or through a defect in the inner wall of the abdominal cavity, such as the diaphragm and pelvic wall. So these are internal hernias are not usually seen from the outside. Okay, so it's inside. There's a hole here in the mesentery, so there's a protrusion of the intestine into that hole. Okay. Same way here, there's probably a band here, adhesions that creates an artificial opening, and then there is herniation of the intestine through this hole. So this is internal abdominal hernias. The other categorization of the different types of hernia is that we just specify the location of the specific hernias. Example, inguinal hernias are hernias located on the inguinal hernia area or cingit or groin. Femoral hernias are those located on the, again, part of the cingit, but it's little lower, okay. Umbilical hernias, there's a navel, okay, in this area. Epigastric hernias in this area. And then Spigelian hernias on the side, lateral. Incisional hernias will be those which occur after an operation. Diaphragmatic hernias will be those which herniated through the diaphragm that separates the lungs and the abdominal cavity. Okay, hiatal hernias will be those near the esophagus, okay, and so forth and so forth. Okay. So these hernias are specified by the specific location. Then as to the congenital versus the acquired hernias, congenital hernias are those hernias present at birth. So kung pinanganak kami hernia, that's what we call congenital hernias. Okay? So the defect and hole or defect causing the hernia is present at birth. In contrast, acquired hernias are those hernias developing after birth, okay, and whose weakness in the wall or the presence of other defects causing the hernias are due to causative factors occurring after birth. Incisional versus non-incisional hernia. Incisional means that there's an incision, there's a cut, okay, previous cut. Okay, that means there's a previous operation. So thus, an incisional hernia is defined as a protrusion of tissue that forms at the site of a healing or healed surgical scar, okay, at the incision. Okay, so it is due to the weakness of the abdominal wall associated with the surgical incision. So as the surgeon operates, goes in, he has to open not only the skin, but also the muscle, the abdominal wall, the fascia. Okay. So when he closes, he makes sure that the fascia, especially the fascial layer, is secured. Okay. If not, there might be a hernia developing. Okay. So in contrast, non-incisional hernias just mean there is no history of an operation. It's as simple as that. Okay. Incisional hernias, may operation. Non-incisional hernias, no operations. Okay. So this one shows the scar, and then there's a bulging here. So it readily, right away, it implies that this is an incisional hernia. So if there is no scar here, we don't call it incisional hernia, but a non-incisional hernia. What are the causes of abdominal hernias? Basically, there's a defect. There's a hole. There's a weakness that allows these internal organs or tissues to protrude or be inserted into it, causing a hernia. So the defect or the hole or the weakness can be present at birth, congenital, or developing after birth, acquired. Among the acquired hernias, prior operation producing weakness of the abdominal wall and adhesions associated hernia is a cause. Other causes include aging, pag tumatanda tayo, okay, because of the weakness of the wall, because of aging, repeated straining, weightlifting, and some rare medical diseases that cause weakness of the abdominal wall due to abnormal systemic collagen synthesis, such as, these are rare, but these are the known diseases that can cause hernia: Marfan syndrome and Ehlers-Danlos syndrome. Are there preventive measures against abdominal hernias? For the congenital hernias, there are currently no preventive measures. But for the acquired hernias, except for the age, which we cannot control also, and medical diseases that like the Ehlers-Danlos that I mentioned, or the Marfans, that cause the abdominal weakness, we cannot control this. Okay. For the others, there are preventive measures. So number one is for the surgeon to do a proper operative technique of the operative wound closure, and this can prevent incisional hernias. And then if there is no operation, in the setting of no operation, so you try to avoid repeated straining and strenuous weightlifting, okay? And this can also prevent hernias to a certain degree. Okay. How common are the abdominal hernias? Okay, there are so many types of hernias. Okay, some are rare, some are common. Okay, but the inguinal hernias or the groin hernias are the most common among the incisional hernias. Clinical diagnosis of abdominal hernias. For the external abdominal hernias, yung nakikita sa labas, so the first cue is that there is an unusual bulging on the abdominal wall. Yan ang unang cue. Yan ang unang clue that you might be dealing with an abdominal, with a hernia, okay, a bulge. Although it could be a mass also, okay. So the next step is to determine whether the bulge, okay, will become more prominent on increased intra-abdominal pressure, like standing up, straining, coughing. Okay. So we ask the patient to cough, okay, and then if there is a increasing prominence of the bulge, then baka hernia na yun, okay. And then similarly, if you try to decrease the intra-abdominal pressure by asking the patient to lie down, okay, or to decrease the no more coughing, then if the bulge becomes less prominent, then that's another cue that the bulge is due to a hernia and not to a mass. Okay, So a bulge there could be a hernia or a mass, but the maneuver that was made here in the second cue, kung may increase in intra-abdominal pressure pag lumalaki, okay, mas matindi, then that's most likely a hernia. The third cue, okay, which is very reliable, if it's the bulge is not painful, there's no other symptoms of inflammation, one can try to push it back into the abdominal wall, okay, through the abdomen. Now, if the bulge can be reduced back or can go back into inside the abdominal cavity, and then so that's the third cue, or the most reliable cue, that the bulge is a hernia and not a mass. Okay, so if that mass does not, if that bulge does not become prominent on cuffing, and then it cannot be reduced, most likely baka bukol lang yon, bukol na, not hernia. Okay. But for the internal hernias, which are inside the abdomen, which cannot be seen, so which will not be evident on inspection and palpation of the abdomen, so these are often diagnosed through the imaging procedures such as ultrasound, CT scan, MRI, or during an exploratory laparotomy. When you say exploratory laparotomy, you open up the abdomen. Okay. When it's done for other causes like intestinal obstruction. Okay. So in the process of doing the exploratory laparotomy, the internal abdominal hernias are subsequently discovered, or parang incidental findings. Okay. So usually the internal abdominal hernias may not be diagnosed clinically, but sometimes it can be diagnosed through the imaging procedures. Okay? And a lot of times, baka hindi rin ma-diagnose through the imaging, but only through the operation. Paraclinical diagnostic procedures for abdominal hernias. Common paraclinical diagnostic procedures are the imaging procedures such as ultrasound, CT scan, and MRI. These are done only when indicated. Usually for external abdominal hernias, kitang-kita na, so there is really no need for a paraclinical diagnostic procedures. Now, if unsure of the diagnosis of a abdominal hernia, then a paraclinical diagnostic procedure can be requested. So basic treatment modalities for abdominal hernias. The basic treatment modality is an operation or surgery. So the objective of the operation is to repair. As we said, hernia is caused by an abnormal wall defect or weakness causing the hernia. So the surgery will be used to repair this hernia. Okay. So supposing that this is the hernia which is protruded there. So it has to be brought back inside first. So you have to reduce that incarcerated hernia. Okay. Then, but in some instances, if the hernia becomes strangulated, meaning the blood supply is compromised, umiitim na, bumubulok na, puputok na, then the surgeon will have to resect this strangulated bowel, and then reanastomose the remaining bowels. Okay, so this is what is meant by to resect any strangulated bowels if present. If not present, you just reduce it and then put it back inside the abdominal cavity and then repair that hole. Okay. So a lot of times, aside from the yung primary closure lang, itatahi lang, then most of us will always use a mesh graft, a graft that will support that defect, that abdominal wall. Okay, ito yung mesh, no? Parang plastic, no? So let's now go to groin or inguinal hernias. As I said, these are very common. So seeing it, these are inguinal hernias, that's a cue. So inguinal hernias are hernias at the groin. These are the commonest type of abdominal hernias, external abdominal hernias. This is the most common. They are more common in males than in females. So this shows the weak abdominal wall. Okay, mababa ang intestine. So this area is the groin area. That's why it's called inguinal. Okay, so if you have a hernia here, we call that inguinal hernia. There are two types of inguinal hernias. One is indirect and the other one is direct hernia. At times there can be a combination of the two. Okay. The direct hernia means that the herniated loop of small intestine will go down through a defect here, okay, pababa, okay, through that parang tunnel that flows with the yung spermatic cord of the male. As I mentioned, mas madalas yung inguinal hernia sa lalaki. Okay. Now, in the direct hernia, it's just weakness of the floor. Okay. Usually occurring in old people. Okay. This is the direct hernia. It does not go through this tunnel. Okay. So this one is indirect hernia. And this is more common in young people. The inguinal hernias are commonly congenital, particularly the indirect one. The direct hernias are usually acquired in older people because of weakness due to aging, due to old age. The inguinal hernias are recognized through a bulge in the groin area, and the bulge is reducible. You can bring it back inside. In those with complications such as incarceration, ayaw na bumalik, at strangulation, namamatay na yung blood supply, okay, nako-compromise na, the bulge may not be reducible anymore, and there will be skin discoloration. Okay, when you have dark blue or even black discoloration, that is already a sign that strangulation is taking place. Usually, the inguinal hernias are diagnosed clinically without the need for paraclinical diagnostic procedures. Okay. Inguinal hernias are external hernias. These are not internal. Kaya usually, makikita kagad just by inspection and some maneuvers. The treatment is surgical for inguinal or groin hernia with repair of the defect or the hole or the weakness preventing the occurrence or recurrence of the hernia. If there is incarceration, reduction is done first. And then if there is strangulation, resection is done. Puputulin yung compromised small intestine. Okay? Yung itim na. Dangers of inguinal hernias when not treated or operated on time, of course, will be incarceration, naiipit, okay, like this. Ayaw na bumalik, okay. Then, pag hindi na siya makabalik, then there will be obstruction. Kasi hindi makadaan yung mga pagkain dito. Okay? So there will be intestinal obstructions. And then, given more time, there will be naiipit na yung blood supply. So, mamamatay na yung bowel. Iitim na. That's what we call strangulated hernia. Okay? So, myth and facts on inguinal hernias. Question is, can an inguinal hernia be cured by a supporter? Yan ang common question or common practice to put a supporter. The answer is no. It cannot be cured, but it can be just a support. So a hernia truss or a belt is a supportive undergarment for men designed to keep the protruding tissue in place and relieve discomfort. Okay, but most of the time, hindi rin 100% successful because kasi gumagalaw ang tao, hindi natin alam kung anong pwesto. No? Okay. So a hernia truss can help a patient with inguinal hernia feel more comfortable temporarily, pansamantala lang. No? It doesn't treat the hernia. It does not cure the hernia. The hole is still there. Okay, the defect is still there. Okay, the supporter does not cure that hole. Can a groin hernia heal itself? Will it disappear spontaneously? Kung hernia talaga, no. Okay, the answer is no. Kasi there's a defect, there's a hole. Okay. A groin hernia is any abdominal hernia cannot heal on its own. If left untreated, because of the constant pressure sa tiyan, straining, okay, standing position, the defect or the hole of the hernia usually gets bigger with time. So palaki ng palaki siya. Okay? So the presence of the defect or the hole in the hernia is a constant risk for incarceration and strangulation of the small intestine, or sometimes the other organs like the ovaries, yung bumababa doon. No? Okay. A strangulated herniated intestine is one in which the blood supply to the intestine is cut off as it is strangulated by the hernia. Sinasakal ng butas, ng defect, yung intestine. Surgery is the only way, hindi supporter, hindi gamot, no? It's the only way to fix the inguinal hernia. The surgeon will push the bulging tissue back inside, close the hole or the defect, and strengthen, if it's weakness, strengthen the abdominal wall, stitches, and perhaps put a mesh, parang extra support. So, summary and takeaway on this talk, I have presented and discussed briefly, gave you an overview on all these topics. Takeaway in relation to patient empowerment, be always in touch with reliable medical information on fundamentals and generalities in the medical management of abdominal hernias. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment, which are kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of abdominal hernias. So this ends my pep talk. I hope I have empowered you to have a better understanding of the fundamentals and generalities of the medical management of abdominal hernias. So before we proceed to the question and answer portion, again, reminder, take the OLETE and then 50 certificates. Pwede na ngayon, after this one, okay, because of this is the 50th lecture, one is entitled to a voucher for a ROJoson telemedical consultation. So let's now have a group picture taking. Ready? Everybody on board? 1, 1, 2, 3. Pahabol. 1, again. May pahabol. 1, 2, 3. Okay. So the floor is now open for questions, comments, suggestions, consults, etc., etc. Who has an experience with a hernia before? Meron? Bihira sa babae yung inguinal hernias, but meron din nagkakaroon ng hernia sa babae. No? So, mas almost 98% sa lalaki. No? Kasi yung sa lalaki, because of the at birth, yung birth process, yung descent of the bayag, the balls, no? So it usually starts from above, then go down, and then through the tunnel into the scrotum, no? Dun sa may bayag, no? Yeah, there's a tunnel there. Kung di mag-close yon, no? It remains open, then you'll have a congenital defect which is called the inguinal hernia. No? Okay. So inguinal hernias makikita kagad sa bata at birth, okay, or even at 6 months kung minsan di pa very obvious, no? because maliit pa. So pwedeng 6 months after makikita na. Kasi the baby usually malikot na. 6 months, no? Kung saan tumatakbo na, baka 9 months. Okay. So my nephew just recently got operated on for inguinal hernia at 1 year of age. No? The operation is very simple, mga 15 minutes lang, tapos na isasara lang naman yung hernia, no? Yung butas, itatali lang. No? Any questions?
Doc, how do they call it in Tagalog?
Lus-los.
Lus-lus.
Lus-los. Di ba?
Yes. Lus-lus.
Okay. Lus-los for
But it's bua, not bua.
I'm not familiar. Bua. I don't know. I'm not sure. What I'm familiar is the lus-los. I don't know whether it's referring only to the inguinal hernia, no? Because there are so many types of hernia. No? Anybody who wants to contribute? Baka may alam kayo, buwak.
Lus-lus.
Ha? Naririnig ko, lus-los. Buwak.
Oh, buwak.
I have a friend who's already 90 years old,
Okay.
and she has this hernia, abdominal hernia. But she consulted a doctor. One doctor said to operate right away, but she got scared and went to another doctor, and the other doctor said, "No, I don't think you should go on with the operation because of the age." But and she's not really in danger because most of the time she's lying down na.
Lying down because
of age. Because of age.
she doesn't move around every day?
No, not anymore.
Not anymore. Okay. Okay, pero number one, you have to diagnose it first. Where is the hernia? No, that's the first thing. No, where is the hernia? Is it in the groin?
In the umbilical side.
Okay. Umbilical. Okay.
Oo.
So umbilical hernia, again, it could be due to the weakness. No? Okay. So
she was just advised to wear a girdle. I mean, something that will hold it. And so far, more than 1 year already.
How old is she?
91 na ngayon.
91 na. Okay, pwede pala na. Oo. Okay. Let me draw. Sandali.
And then sometimes it goes to her near the groin.
Huh?
Near the down, it goes down. So I think she has two.
Baka 2. Malayo kasi.
Dalawa. Oo, dalawa.
Malayo kasi yung ano eh. Ito yung navel, di ba?
Yes, that's where it usually goes out.
So medyo malayo yon. Kung ang bulge
So
niya,
there must be two.
yeah, one is here. Kung may bulge, the other one is here.
Yes.
So kung dalawa,
Yes,
kung may
yes.
medyo malayo not to be connected.
Layo.
So baka yes too. Okay, at 90 years old, no, usually ito yung balat, ito yung ito yung pinakamatibay, yung fascia, no, yung kasi di ba pag at birth usually meron tayong
That's side view, no? Side view.
side view. Di ba meron tayong cord, umbilical
Yes.
cord, so kinakat yan, no? So nagsasara na yan, no? Okay? So it means there's an inherent defect here.
Weakness.
Yeah, as time goes by, pag tumatanda na, nagwi-weaken siya. Okay,
Mm.
so pag nag-weaken siya, di magbabulge siya na konti. Ganon. Okay. So pag tumatagal, no? Okay, especially when a person keeps on straining, no? So yung intestine will keep on trying to push palabas. Okay. So kung palabas, okay. Over time, this one will become bigger and bigger. No?
Yun.
Okay.
Always like that.
Oo, gano'n. No? Okay. So, yeah. So kung malaki naman siya, usually kung malaki ang hole, no? So kung malaking hole, there's less danger of being incarcerated. When you say incarcerated, yung hindi siya makapasok ulit. Compared to small one, the small one kasi baka gumanon eh. Okay.
That's right.
Pero pag malaki siya, yung butas, it will just bulge. It just keep on bulging. Istorbo lang sa pasyente. No? Okay. So that's why probably the surgeon says, the second surgeon says, no need na lang because 90 years old na siya. No? Saka hindi naman siya active. No? Okay. So just put a binder na lang or sometimes they would put sometimes they put a coin.
Yes.
Kasing laki ng bulge niya and then just tie it down to the waist. No? Ganon. Okay. So ganun din dito sa sa inguinal hernia, bumaba yung small intestine, di ba? Bababa, no? So usually pag small lang yung hole, hindi masyadong makikita. But as time goes by, because of the activity of the person, lalaki yung butas, no? Eventually magbabulge siya, no? Ganon. Okay. Okay?
Okay. I will explain it to her.
Okay. Gaano kalaki? Gaano kalaki yung sa kanya?
Big. Like dun sa umbilical, parang nakakatakot because it becomes like kasing laki ng ng kamay like this.
Laki malaki.
Oh, malaki. So there must be a big opening.
Yeah,
because sometimes it becomes small, sometimes it becomes big.
Yeah. It becomes small kasi natutulak eh. Pumapasok siya. Binder na lang.
She became my guest because she had a family problem and I had to take her in. That's how I discovered because at 90. And then when she was here in my house, we had a problem one night because she said it was turning blue already. And I was told by the doctor, pagka nagta-turn blue na, baka those are signs of strangulation, no?
Correct.
And so I had to bring her to the hospital only to find out na after a while, because she's does not she does not poo a lot. She's constipated most of the time.
Yeah.
And it's very difficult to take care of her.
Yeah. When you're of age na, usually may constipation ka, and then you keep on straining. So pag nag-strain, tataas ang intra-abdominal pressure mo, and then palabas yung intestine mo, di ba? Palabas dun sa butas. So lalaki siya, no? Okay. So you balance it with kung med all the time nasa bed na siya, wag na lang. Pero if she's still active, there are people who are 90 years old who wants to walk, to do a lot of things, no? So baka kailangan operahan, di ba? Okay.
Yes, the doctor said if in case you see signs of strangulation, that's the only time I will operate on her. Otherwise, I won't advise it because she might even die on the operating room.
Yeah. Okay, that's correct. Okay, babalance lang, benefit and the risk. No? Okay. So any questions on the chat box?
Yeah, there's a question or comment from Jocelyn T. I have hiatal hernia on and off appearing in my endoscopies.
So hiatal hernia is esophagus hernia. Okay. Okay. There's a, this is the diaphragm. Diaphragm, the one that separates the diaphragm. Ito yung abdominal cavity ito, no? Ito yung sa lung, sa chest, no? Okay. Okay. So, when you say hiatal hernia, ito yung esophagus, galing sa itaas, di ba? Esophagus, then pababa, no? And this is the stomach. Okay. So, when hiatal hernia means, hiatal means opening, di ba? The opening through which the esophagus passes through the diaphragm going into the abdomen, no? Okay. So when you have hiatal hernia, so baka at maraming klaseng hiatal hernia. One is yung maakyat itong stomach pataas, no? So ganon. Okay. So normally it should be at least below the diaphragm, di ba? Okay. Pero pag umakyat siya to the chest area, hiatal hernia, no? So the other types of hiatal hernia is kasi may butas dyan. So yung stomach, part of the stomach would go inside. Okay, ganon. Okay. So hindi yung sliding pataas, pero may isang portion ng stomach is pumasok din dun sa butas, no? Okay. So basically these are the two types of hiatal hernia. Okay. So if endoscopy, this was discovered through endoscopy. Okay. So I don't know which type was seen, but usually mahirap i-distinguish yung dalawa eh, no? Okay. So through endoscopy, ha? So, but if you have barium, no, that when you put dye, so if you see bulging there, no, then you can say this is a para-esophageal hernia ang tawag doon, no? Ito is sliding, no? Okay. Or you can CT scan, kung minsan, CT scan, MRI can discover this one, no? Okay. Okay. So anong question mo? If it's not symptomatic, no? Kung minsan may konting slight hernia rin talaga, no? If it's not bothering you, you don't have to have it operated on, no? Okay. Kasi mahirap mag-operate dito eh, no? In that esophagus, no? Okay. Okay.
Is that internal or external? Obviously internal.
Yeah, it's classified as internal already, that you cannot see from the outside, no? Okay.
My gastroenterologist did not suggest surgery yet.
Baka mild lang, no? That's why I said, kung minsan, you have to determine what's the basis of the diagnosis. Baka, kasi endoscopy, mahirap. Kung minsan, mahirap lang sa endoscopy eh, no? Through the endoscopy lang, no? Okay. So you may have to do some imaging procedure like CT scan or barium swallow. Okay, but you only do that when you have symptoms. No. Okay?
Sa CT scan, nakasulat lang small hiatal hernia. Yun lang.
May CT scan ka, small hiatal.
Meron. Yeah. Small hiatal hernia. No location.
The location is here.
Hiatal.
Oh,
That's the
yun lang.
location.
Oo.
Most likely, ganun lang. Baka tumaas lang ng konti. Ganon. Ganon.
Mhm.
Ganun lang. Okay? Tumaas ng konti. Small. Na?
Asymptomatic.
Madalas po ako may plema eh. I don't know kung galing dyan or hyperacidity or what.
Usually, no. It's not due to that. Ano. Okay? It's not due to the hiatal hernia. Usually, ang nagkakaroon ng problema, ito yung mga ganito. Parang naiipit eh. Di ba? Okay. Part of the stomach will go up there. Na? Okay. Pero usually, parang regurgitation ang lalabas yan. Di ba? You can say regurgitation. Yung acid paakyat. Di ba? Kasi naiipit. Di ba? Okay. Pero kung mild lang, no, you don't have to do anything about it. No?
Yes, thanks.
Okay? So may mga
Okay.
different sa katawan natin, maraming variations, not exactly in the same position that what you call is normal. May konting maakyat lang konti, no? So you can call it hiatal hernia because of the definition that is given, that something that protrudes inside the hole, no, is a hernia, no? But it doesn't mean always that it's something that you have to worry about, that you have to have it operated on. So you just observe if there are persistent symptoms of regurgitation, no? Then that's the time you have it operated on. Hopefully not, kasi mahirap operation na yan, no? Okay.
Okay, thank you, Doc.
Okay, there is another one from Ma'am Jackie Tong. Aside from the bulge, is it also normal to experience pain?
Yes, because naiipit. Pag naiipit siya, so, lalo na kung malaki yung maliit ang butas, no? Naiipit yung hernia dyan, sasakit ng konti. Then, pag bumalik, no? Spontaneously, nagre-reduce, bumabalik sa abdominal cavity, mawawala ang pain. No? Mawawala ang pain. No?
Tsaka Doc, palaging may gas. My friend was very gassy. Why like that?
You have gassy only when you have obstruction already. Okay. Pag nagbara na talaga. Pag nagbara, then you experience gassiness. No?
But she passes gas. After passing it, parang baliwala na.
Kaya nga.
So it doesn't really bother her.
Okay. Kasi when you say gassiness of the abdomen, okay, it can mean non-specific lang. There's no obstruction, no? Hindi nag-iipon yung hangin, no? Okay. Parang may kinakain lang tayo mga foods that will cause excessive air, no? Then, after the gases pass out, wala na, di ba? Wala na yung symptoms, no? But there is another instance in which there is obstruction, barado ang stomach. When you barado yung stomach, then the gas will accumulate above the stomach, di ba? Or yung gas will accumulate inside the small intestine kung may mas mababa ang bara, no? So lalaki ang tiyan, di ba? Okay, ganon. So kung nawawala naman, no, yung gassiness niya after sometimes, most likely wala siyang bara. It's just the usual way of gas forming instances, in circumstances, na? Okay.
Okay, there is another one from Maria Justa Polotan. Can hernias recur?
Yeah, after the operation, it can recur. So a hernia, if not manipulated by an operation, no, we don't call that recurrence. It can be a progression, di ba? So once you operated on a patient, so the goal is to fix the hernia, di ba? Para hindi siya umulit, no? Pero during the operation, kumisan, there's a failure in the achieving the objective. So magkakaroon ng recurrence, no? Okay. So you can have recurrence dun sa after an operation of the hernia, in groin hernia, okay? At the same side, now let's say you operate on one side, kasi kung minsan, groin hernia can be bilateral. No? So umpisa, isa lang nakikita. No? Okay. So once you operated on one side, you don't touch the other side kasi wala kang nakikita initially. No? So kung may umulit, it's either kung umulit dun sa inoperahan, no? So that means a recurrence of the hernia in that side, on that side. Okay? Something might have gone wrong with the operation. Okay? Baka hindi natali ng gusto, baka na-release yung tali, gano'n, no? O kaya yung hindi naglagay ng mesh because weak na yung floor talaga to start with, no? Now, pag may umulit dun sa kabila, we don't call that recurrence. It's another hernia, no? Okay? It's on the other side na hindi ginalaw, no? Okay? That's not a recurrence, but it's a hernia that appeared already. Okay? That developed, no? Okay. Okay.
Yep. Thank you, Doc.
Okay. Any more questions? We still have 5
Nothing at the
minutes.
chat box.
We still have 5 minutes. Any questions? So we have discussed hiatal, umbilical, and then groin hernia. So ano pang mga experience niyo with the hernia? Incisional hernia. Sino may incisional hernia? Sino may cesarean? Pag may cesarean, pwede kayo magkaroon ng incisional hernia. Diba? So fortunately, wala. Okay. Any more?
Nothing at the chat box.
So 4 minutes, last call.
Hey, Doc. Doc, how about yung inapurahan, na-opera yung matres? Magkakaroon din ba ng hernia?
No, hernia sa abdominal wall.
Kasi tinanggal yung matres para isopag yung fallopian tube.
Yeah. Hindi problema yung sa loob. Yung pagtahi, di ba? Kasi dadaan ka sa tiyan eh, di ba? Hihiwa ka ng tiyan.
Yes.
So dadaan ka dun sa muscle, dun sa fascia. Yun ang pinakamatibay doon. Hindi yung balat, ha? Balat is not hindi matibay yun. So yung sa loob, no? So dapat pinatahi ng maganda yung yung sa loob, no? So pag hindi maganda yung pagtahi, no, it could cause a hernia. Okay? So babulge, no? Okay. So or kung minsan, magkakaroon ng infection, pag nagka-infection, masisira yung tahi sa loob, di ba? Okay? Yung sa wall, pag nasira yung tahi sa loob, bubuka yun ng konti, magiging weak. No? Over time, pag nag-heal yan, kahit na nag-heal siya, pwede siya mag-hernia. Na? Okay? So
Kung may tahi dun sa loob, may tahi sa loob, tapos may tahi sa skin.
Yeah. Okay.
Dalawang tahi ba, Doc?
Usually, 2 layer, minimum. Na? Okay? Pero mas importante yung sa loob. Yung sa wall. Ha? Hindi yung sa skin. Okay?
Yes, Doc. Yes, Doc.
So
Thank you, Doc.
that's the more common type of hernia after hysterectomy. Yun, incisional hernia. Na? Okay. Ganun din sa mga cesarean, ganun din. Pwede rin mangyari yun. Kasi hinihiwa yung tiyan eh, di ba? Okay. The other type, kung minsan may adhesions, internal hernia naman yon. Kasi pag naoperahan, kung minsan maganda yung tahi sa wall, pero sa loob nagkaroon ng yung mga tinatawag na adhesions, dumidikit-dikit, no? Okay? Kung minsan magkikreate siya ng isang false opening, no? Then papasok yung intestine dun sa loob. Yun ang internal hernia, no? Pero bihira yon, bihira, no? Okay? Kung minalas ka na lang.
From Ma'am Jocelyn
Doc.
T. Doc,
Thank you.
nakikita ba sa CT scan incisional hernia?
Yeah. Pero ang first cue talaga, if you have an operation, that's it. That's incisional hernia. No? If you have an operation, you call that, you have the bulge near that incision, yung hiwa, no, yung scar. you call that incisional hernia already. Na? Okay. You don't need CT scan anymore for that. Na? Okay.
Doc, I remember yung buwa na sinasabi ni Ate Chuchi. My sister was operated on by an OB-GYN and he says it's buwa.
Buwa. Buwa.
Yeah, buwa.
Okay. So OB-GYN, buwa. So hernia, pero baka, hindi ko alam whether it's incisional. Ha? Kasi operated on, buwa. No?
Yeah.
So let's look it up. Let's research on those terms. Buwa. No?
Buwa.
Buwa. Okay. Okay, so if there are no more questions, let's call it a day. So what will happen next time? So we'll have another lecture.
Doc, may follow-up.
Ma'am, may follow-up si Ma'am Jocelyn T.
Okay.
Does it mean hindi malinis ang pagkakatahi?
Yeah, it could mean, yeah, that's one possibility. That's why we always, when we have yung mga audit ng mga surgeons, no, bakit nag-incisional hernia, no? So we always consider that baka hindi maganda yung pagtahi, no? Okay. Number two, as I said, kumisan, nag-infection, no? Okay. So bubuka rin yon ng konti, maging weak, no? Okay. Okay. So basically, you're talking about incisional hernia. Incisional hernia is it's either, but the primary reason is the surgeon's call, yung decision niya, how to take care of it, how to prevent it. Na? Okay. So kung ang decision niya ay mali na at hindi niya natahi ng mabuti, then that can cause incisional hernia. Na?
Okay, thank you, Doc.
Okay?
Okay.
No more questions?
No more at the chat box.
So what will we do next week? This is the 50th. We'll have another one?
Yeah.
Yes.
Yes.
Okay.
Yes.
Maghahanap ako ng topic. Okay. So, okay. So at the moment, I just have one prepared, laughter exercise. That just have para to our laughter exercise for well-being, for health and well-being. No? Okay. So we'll have a laughter exercise para to have a break na sa mga serious.
Tatawa tayo, Doc. Tatawa tayong lahat.
Yeah, tatawa tayo lahat. No?
Tawa tayo.
So, kung pwede, you can search the internet, you look up the laughing yoga. It's pattern after that, laughing yoga. No? Okay. So after that, tuloy pa ba tayo? I have to look for other topics pa.
Yes, Doc.
I
Yes.
voted yes, Doc.
Oh,
Yes, yes.
okay.
Absolutely.
So itutuloy ko lang ito. If we can maintain it at least 17 tayo ngayon. 20, kanina 20, no? Okay. 15 to 20, basta okay lang.
Yeah.
Pag naging 1 na lang, wag na lang, di ba?
One-on-one.
One-on-one.
Okay. Sige. Okay. I'll try my best. If you can recruit some other people to kahit one friend to attend, mas maganda. Para I can prepare some more for the Okay?
Thank you, Doc.
Okay. Sige.
Thank you, Doc.
Bye-bye.
Thank you.
Okay.
Bye-bye.
Bye-bye.
Thank you, Doc. Thank you. Thank you.
Bye-bye.
Bye.
Thank you.
Bye po.